does not improve lives. And this is a philosophy that drives me and drives my work as a researcher. Research, in my view, must go beyond just academic publications, and it must really contribute to real change that is tangible in the lives of the people that we aim to help. Um, my work has always been about just translating evidence into actionable policy and practices that directly benefit the community. And I hope that the resource center that we will be launching today will be an embodiment of that commitment, where we hope to be turning science into practice to improve the mental health outcomes and to just offer hope to the people of Kilifi County. Now let us dive in. I would like to present the findings of a mental health survey in some counties of Kilifi in preparation for today's event. Mental health disorders, that was depression, anxiety, substance misuse, and suicidality. We used standardized questionnaires, which are the patient health questionnaire 4. We included an additional question on suicidality, and we used the KGA, which is a questionnaire that measures both substance misuse and alcohol misuse disorders. And these questionnaires were administered using an online app that we developed, and they were administered by volunteer enumerators who came from different youth groups. This slide just shows the incredible work that went into collecting the data that I'm presenting today. We had a 35-member survey team, and they were conducting these surveys both by sharing the links to the survey online and by going in person to very remote places in different sub-counties to administer this questionnaire to different participants. And I think their dedication was very. 79 people viewed the link to our mental health survey, but 3,225 completed it, which represents a response rate of about 41%. Some of the reasons for this response rate included concerns about online scams that are usually shared as links and scam websites, which are commonly circulated, which made people very hesitant to participate in the survey. And I think this really highlighted to us again, this very closely maps to the overall social demography of the country, where majority of the population in our republic are young people, and that was a finding that we also got in this survey. And to honor today's theme, which is workplace, time to prioritize workplace in the mental health, we also looked at the different occupational categories, and we found that although there was some fair distribution between those who are employed, those who are self-employed, and students, the majority of the participants were unemployed. And I think this is a fair representation of the overall state of the country and the county at the moment. And so to commemorate today's theme, we began by doing our analysis by looking at the prevalence categorized by the different occupations. When it came to depression, we found that 22.9% of all the participants reported mild to moderate symptoms of depression, and which compares very well with the national and global prevalence rates, where we say about 1 in 4 people at some point in their life will report a depressive symptom. When we looked at depression rates across the different employment status, students had the highest proportion of depressive symptoms at about 27.6%. Interestingly, there were no statistically significant differences in depression rates between those who were self-employed and those who were unemployed. However, those people who were employed had the lowest rate of depressive symptoms at 20%. And low here is relative because it still is a very high proportion when we look at the overall prevalence data. These findings offered very valuable insights how employment status may impact mental health. But I think the key message from this slide was that students are a particularly vulnerable group when we're thinking about depression. When we looked closely at the different employment groups, again, we observed that the students had the highest levels of anxiety. Interestingly, we did not have any significant differences in anxiety levels between those who are employed and those who are unemployed. And the self-employed people had the lowest proportions of anxiety symptoms. And this really offers very valuable insights into broader societal issues. Factors such as job insecurity, high taxes, pressures of self-employment may have contributed to the anxiety levels even among those who are self-employed. And these findings just suggested to us that economic and social challenges that are affecting mental health employment status remain constant, and we need to pay greater attention to the impact of financial and work-related stress. And then when we looked at suicidality, we found that 3.5% of respondents at some point in their lives. This to us was a very, very concerning finding, especially when we consider that the World Health Organization reports that every 40 seconds someone employment groups, we found that the highest prevalence of suicide was among the self-employed, followed by the students. Vulnerable population for common mental health problems. And you see that the differences in proportions should not be suicide, and every statistic in this category highlights a very, very urgent for intervention. Prevalence of substance use compared to the other category. And we have to be very cautious about these results. We should not overinterpret these results, because that there was some potential reporting bias, because participants may have feared consequences of disclosing their substance use. Um, Another point that I would like to bring here is that when you closely look at the graph, you can see a tiny little light blue line in the unemployed category. This is because it is the only category, the unemployed people, where we had people who reported moderate and severe substance misuse. There is no other group where we had severe substance misuse. And this again brings us back to the point of the connection between socioeconomic factors and substance misuse. But I will not dwell and emphasize on these slides, because we want to be cautious in presenting some of these results. Maybe as a function of the sample sizes that were represented in the different sub-counties. Although, just to summarize what I'm showing in this slide, the pink bars represent anxiety, the green bars represent depression, the blue bars represent substance use, and the purple bars represent suicidality. And the length of the bars indicate the prevalence. So, for example, Malindi sub-county showed higher levels of depression compared to others. However, what we can see, or the takeaway message from this chart, is that across all the 4 diagnostic categories, we had cases in all the 7 sub-counties, which indicates that the need to address common mental health issues is prevalent in every sub-county. And I would just like to finish by saying that this data is available as open access for any partner or individual who might be interested in looking at this and doing further analysis, for example, related to the correlates of depressive symptoms. And in conclusion, firstly, that anxiety was prevalent among the participants, and students reported the highest level of anxiety. These findings suggest that there are broader societal pressures, such as job insecurities, high risk, as no group is immune to these challenges. When we looked at alcohol and substance use disorders, although there were differences in prevalence across the different employment status, this highlighted that there is a very strong connection between socioeconomic factors and substance use. For example, the high prevalence of substance misuse among those who are unemployed. And lastly, mental health issues, including depression, were found across all sub-counties. Despite variations in the prevalence, we urge emphasizing that there is need for interventions to address common mental health problems across all the sub-counties. Of course, we will continue to do our, and of course, by acknowledging the focal person for mental health who supported and spearheaded this, the President Edwin Kiraitu and Eliezer Okulu, and the sub-county focal people who are really in mental health, who are really supportive in making sure that we had data collection going.
Thank you very much. So that was the presentation from the survey that we did in regards to our theme. And I hope that we'll take notes of the conclusions and act accordingly. So I welcome our Director of Health, Dr. Hassan Leli, to take it up from here. Thank you.
Honorable CEC for Health, Dr. Kabarogo, Dr. Masha, Financial Kilifi, Jambo. My name is Dr. Hassan Leli, Director Health and Sanitation Services. Really a pleasure to be here today on this auspicious day, World Mental Health Day. The message speaks for itself. We must really take care of mental health. Importantly, for the workforce, as you've seen for the day, healthcare workers really play a part, taking care of the people, but who takes care of our healthcare workers? So this is really not noble venture. We're really glad we're here to open this center, and we're really appreciative to this CIMO for really taking up the initiative like this. It was said from my Excellency the Deputy Governor. It is important to have a place for Kilifi as well, and today we are here to achieve, following Kisumu for launching this initiative. So it is a great initiative. We are empowered by the Mental Health Act of 2022, and legally it gives us the powers and the responsibilities for taking care of mental health for Kilifi citizens, Kilifi workforce, and everyone else at large. Today, I would also like to Red Cross and see the neighbors and partners. Seremanami Mama. Seremanami Mama. Of course, our distinguished guests, host, the CIMO. Once I have one piece of paper, I'm seeing also present here from the Youth Advisory Council. I'm seeing here, Matia Suma, Sana. So I would like to invite Madka, the Deputy Project. Madka,
thank you very much. Our Deputy Governor, the councillors for health and for culture, gender and sports, the distinguished guests. Good afternoon. Okay, as we celebrate the World Mental Health Day, we thank the government of Kilifi and all health stakeholders for supporting this event at our center. The Malindi in collaboration with the Documentary Institute of Eastern Africa, our efforts received significant media both locally and internationally. This participate in global projects highlighting the critical issues surrounding men, especially the stigma and marginalization faced by those affected. Our partnership with Kilifi, a dedicated initiative aimed at removing the obstacle to mental health treatment, promoting collaboration between traditional medical health practitioners and biomedical professionals, encouraging joint research efforts and the publication of findings to benefit the community, raising public awareness to combat the stigma surrounding mental health illness, for the enforcement of laws to ensure mental health patient journey. We appeal to our partners and stakeholders for support financially. What we have achieved so far is just the beginning. And public awareness to ensure that all mental health patients in Kilifi are treated with dignity. Namalizia kusema kwamba Kilifi County kama Dr. Mary alivyokuwa akielezea ya kiakili ambayo iko hali ya juu sana hapa Kilifi, tukilinganisha na pia sana wako na matatizo ya kiakili. Mfano wale ambao wanaua watu kila siku. Akirudi kwa kijiji, yule mtu huwa yale akili yake huwa haiko sawa. Kwa hivyo tunaomba kwamba the county government and stakeholders tuweze kushikana mikono, tuweze kuangalia kwa umakini hili tatizo, kwa sababu limeweza kuumiza kaunti yetu ya Kilifi. Asanteni sana.
Asante sana. Makofi tena jamani. Ningependa sasa kwanza kwa tamati nyingine, ningependa kualika wageni wetu walio hapa. Alafu kabla kumaliza tutaingia pandani, lakini kabla hapo ningependa kumwalika Mheshimiwa Zero, Chair Kilifi County Health Assembly Committee. Karibu sana Mheshimiwa.
Asante Director. Excellency Chibule, CC, Waziri Nama, wakazi wa Kilifi na Wadaktari, hamjambo? Hamjambo tena? Mimi mmoja ni Zero na kwa sasa ndio Chairperson Health Committee Kilifi County Assembly. Kwanza nataka nishukuru wale ambao wameweza kunitambua kwa kunialika kwa shule ya leo. Mwaliko rasmi nimepata leo, lakini nilipata simu I think 2 or 3 days ago. Na nimeona si vyema nikose kufika, japo nimefika uchelewa, but nimefika naweza kuja free na nipatia picha mingi sana kwa kwamba mental health is an issue in our society. Give an example. There was once a boy who around 23-25 years old who came to one of the facilities in Mariakani. Alikuwa na signs za kukimbia pale nyumbani na kutaka na kuchukua history, tukapata ameenda amepima HIV. Then majibu ni kama alikuwa hajaweza kuinterpret vizuri. So according to him, he was positive and he was dead. So so tulimcancel pale, and then alitulia. Alikuwa kama ametulia kidogo. These are the signs of the depression. So the family demanded to take the boy home. They had insisted kwamba the boy should be admitted, kwa sababu mimi mwenyewe niko na life experience in depression. So walipompeleka nyumbani, huyu kijana that night akajihang. Then the following day he was gone. So zile story ambazo zilitokelezea kule mtaani sasa ikaonyesha ni kwamba alipima HIV, lakini alifanya ile self testing. Sasa ni kama aliambiwa ukiona mstari mwekundu umechora already uko positive. Sasa kumbe ilichora mstari mmoja, but it was unfortunate the boy was gone. So as we celebrate the World Mental Health Day, tukumbuke wale kule mashinani, kwa sababu mental health it is true kwamba we are people who are really suffering, and sisi kama wauguzi wa afya kule mashinani, I think we have a big role to play. Na naona itakuwa vyema our community health promoters in the villages. I think these people will be able to identify these cases early, so that we can help them in these services. So mimi nimekuja tu niambie we are together, and some of the MCAs are also suffering the same way, even from their villages. Ni kweli hii kitu si ni kwa kila mmoja. Mimi nilikuwa naongea na Hassan hapa, nikiambia maybe there is also sometimes I make decisions zenye zina shock wengi, because I was once a victim of depression when I was young. Unajua the social economic thing. Poverty is, I think, is one of those things which contribute to depression in a certain way, even before the drug abuse. So sababu kama unaweza sio na pesa, si ndio? Mambo anajinyonga wengi wala kule mashinani, wanaenda anajinyonga ile sababu mimi ile depression nilichapa kwa sababu by then I'm the first born in my family. we were 7 by then. I was less than 20 years old, around 14, 15 years. I was in class 4, I think, at that time. Sasa mamangu, by then my late dad was working in Mombasa, katika wale hizo ni za Wahindi. So then kule naye fortunately akapata mpango wa kando. I'm sorry because my dad is already gone. So ikawa kuja nyumbani sasa ni ngumu. So tumeachwa na mzazi mwenye hajasoma, hana kazi na hana anything. So ikifika asubuhi mnaangaliana kwa macho, ikifika mchana mnaangaliana, ikifika jioni sasa unajua ni ile mnapika mawe sengine ngoja kidogo chakula nayo bado mnalala. That thing is real. So it happened that my mom also akaja kama nalipuka. So na sometimes wanasema wenda wazimu, sote ni wenda wazimu, but ni the degree. So this time my mom akadevelop ile tabia za uganga, kuronga. Ragiria mama mwenye kuronga. So ikifika asubuhi mamangu hayuko kwa nyumba. Ameenda akikuja, akakuja na unga, anakuja na zile matawi zile za garoma. Kuna zile majani zimeenda kuchukua kwa msitu. Na sasa hawezi kumwongelea shida hiyo time, sasa yeye already ako violent. Sasa mimi ndio first born ndo mzima pale nyumbani. Alafu kiangana pale first born, yule second born mlipeza lini? Jana. I think I tested the rope. There's a time I want to kill myself. So difference is real. Kwa sababu ilifikia mahali sana unaona hiki kiko hii maisha yako inaelekea wapi? Mwenye anategemewa haizi saidia. So ikafikia mahali ilikuwa na mambo hayendi vizuri. But thank God. Nafikiri nilipotoka hapo niliokoka na hadi sasa Yesu ni Bwana. Hadi sasa Yesu ni Bwana. Na nataka niseme pia my testimony sometimes imesaidia watu wengi. Because all those people who attempted suicide, apart from that one who when your family wali decide waende naye na akajinyonga, most of them are now in church. Juzi mwingine nilimuona yeye pia alienda akajinyonga, akakatwa, akaletwa kwa facility, tukakaa naye pale siku 2, alienda kadisajiwa. Juzi nimemuona anambia sasa mimi mzee sikosi kwenda kanisani, ila Jumapili mimi niko church. So mimi nitasema tu nataka kupongeza mtu wetu kimoja, na I pledge my support, fully support. When I hear anything concerning mental health, kwangu mimi kuna maana kubwa sana, na let us help those lives. Let us engage the CHPs. Kama ni budget, I pledge my support. Leteni policies kwa bunge, which are assist one another, tuone kama we can help our community ili kwa maana pia wao wataishi vizuri. Asante sana na Mungu awabariki. Ningetaka nimwalike waziri Peter Mwarogo aweze kuhutubia. Asante sana, Mungu aweze kuwabariki.
Asante sana Chair Mheshimiwa Zero. Deputy Excellency Deputy Governor, my colleague Dr. Ruth, our guest, our visitor today, Madam Kale, partners ambao mko hapa, wenyeji wa Kilifi. Ni furaha yangu kubwa kukaa mbele yenu, simama mbele yenu kuzungumza kuhusu mambo haya ambayo yametuleta hapa hivi. Madam Deputy Governor, wakati huyu mwenyeji wa Kilifi alipokuwa akiongea kuhusu Kilifi, ili nikumbusha ile wakati wetu. Unajua wengine wenu mlikulia town. Hawa wengi walio hapa ni watu wa digital, wanacheza na makompyuta wakiwa wadogo. Sisi tulicheza hiyo gole, kibe, na kweli ilikuwa ikifika wakati wa kujitoa mpaka useme difu simu ndio uweze kutoka, otherwise utakuwa utaenda hutalala. Ukienda nyumbani huku wale wenzako watakuja wakasema hukusema you're still in it up to now. Kwa hivyo hiyo kuchukua hiyo cultural context na kuiweka katika hii ni jambo la kufurahisha sana, because Tabu moja ambayo tuko nayo katika afya ya akili ni appreciation ya hiyo issue katika community. Haiko na haianzi hapa Kilifi, haianzi iko kila pahali Kenya mzima. Nakumbuka wakati wa bomb blast ilifanyika pale American Embassy, watu wengi waliathirika na families waliitwa wafanyiwe counseling kwa kuwa walikuwa wameathirika na hiyo, na watu kidogo sana walijitokeza, maana hawakuwa na ile understanding kwamba hiyo issue inaweza kuaffect katika kiakili. Lakini so lazima tu ile mikakati kama hivyo alivyosema, kuwafahamisha watu kule nje kuna matatizo mengi ambayo yanaletwa na afya ya akili, lakini watu hawafahamu. Walopa, mchawi atapatikana, mzee wa watu atauawa, na ni mambo ambayo yanaweza kusuluhishwa. Kwa hivyo sisi tuko na mipango na nitaeleza katika ile kuintroduce ile kamati, lakini kabla hapo ningependa kumkaribisha Madam Kale ongeleshe kidogo experience yake katika hii mambo ya afya ya akili.
Good afternoon. Good afternoon. I greet you all in your name. Your Excellency, Deputy Governor, Madam Flora, I'm so excited that I'm here. You know, nimetoka mbali na wewe. All the others are so excited to meet you. But I just looked at what we have today, because in 1989, I was working in Mathare Mental Hospital. And that is when my interest in mental health became so huge. Reason being, when you become a psychiatrist, the only two places to be posted, Mathare and Portuguese. Was there any other? Some of you are just babies there. But then also the treatment was very inhumane. We didn't know what to do until the Acts of Parliament were done. I'm so grateful that this thing is happening, and I'm grateful that I'm here today to witness. Now, this should not be the only thing that we are launching. Let us continue in partnership, because mental health still holds a stigma. True. Kila soko iko na I'm a counseling psychologist. That's when I changed. I really wanted to know the relationship between behavior and the mind. So that's how I ended up as a counseling psychologist. That's how I ended up as an addiction counselor, because also I really wanted to know. You ulevi unaambiwa mpaka kidney, mpaka liver iko kama kuni, but you still continue. So what is it? So in simple, I just want to tell you, mental health, kama kuna kitu mtasahau hata mkisahau jina yangu, mental health is your relationship with the environment. Simple. When do you think a child starts issues of mental health or mental health? In utero, the minute the sperm and the egg meet. When the zygote is formed, that is when. Because imagine when the kid starts developing hearing and the parents are in an abusive relationship. The father is always beating the mother. So these kids, when they are born, they know I'm coming to an environment with even your own money. Mazi, mnapendana na pesa zako? Haya. What is your sibling? What is your relationship with your colleague? Especially caregivers, for those who work in hospital. Let me tell you, caregivers go through a lot of trauma. The vicarious, seriously. So there was a lot of vicarious trauma from those people who worked with Shakaola. Suicide, I had that lady mention about suicide prevention. He stopped and tried to remove that stigma. When wazes are being killed because they were child, to have a reason for everything. But let's normalize, let's make mental health a normal thing. The way you go for a checkup, for your mental, for your physical, please also make sure see a counselor. And this is when you come to see a counselor, you can manage your life. Men are told, well, you're very weak, you can't go and see a counselor. So if you have issues, just find. I know there will be this center and many others. Seek help and create awareness. I know I will work more with you because I told her I want to have a relationship with Kilifi. And I'm so glad that she gave me that. And I'm so glad to be here. Now, when we come about mental health, about relationships, I just want you to know it is the whole life, all around. Your husband, the relationship, the situation. He talked about poverty. Too much money can make you have mental health issues. Really? You don't know how to manage it. If we win the lotto leo, you 10 million. Yeah, so it is your environment. How are your relationships? Just know, be aware about your relationship with you and self. What is your relationship with your food? What do you put in this body? Seriously. It's not just a relationship, your husband and wife, girlfriend, boyfriend. No, it is just about your relationship all round. How do you do your waste management? Unakunywa hii chupa ya maji, unarusha chupa pale. Nani atakuja kuyokota? Just simple things. Start with yourself. I don't want to take so much money, so much time. So I really appreciate. My name is Edith Kale. I'm based in Mombasa, but I'm a friend of Kilifi. Thank you.
You're welcome to Kilifi. We are. So certainly you'll be part and parcel of our team. We'll connect with you and agree on how we go about it. I would like to request Dr. Dama, and you know that is really her professional background. So we could not, and then she's also in charge of youth, gender, disaster, all those things related to mental health. So she's really in the right place, the right person to deal with those issues. Karibu.
Our Deputy Governor, Madam Flora, Waziri Mwenzangu, Difusimo, and all stakeholders. I am now is a social protection because it has everyone else is the safe space, but the same clients are served by Waziri Mwarogo when they are sick, and the same clients are served by Waziri Kaingo when they need education. But the other community is maybe under me. So what have I done in Kilifi County for the 2 years? GBV, I realized that the nexus between suffers some mental health because of the stigma. They never went for it. They are raped, and then they get sick. They don't get help. They don't have afraid. They cannot say who did it to them for them. So this thing is what I want us to really focus on, but we didn't have the safe space. The second thing that we did through other partnerships is training of defined or you go through any form of trauma. In the Department of Youth, we have been able to work with the Youth Advisory Council, Mr. Bush. We worked with the Scouts and have mental health talks because we boy who loses a parent before the age of 10 has a prevalence of getting depression, and that is why maybe you went through that. I'm sorry, Dr. And the other side, if a girl, a female child, loses a father at the same age, also has a similar incident. So it is time now when you go for those gatherings and you've seen that someone has been bereaved at an early age, to pick that child up and work with them, because I know poverty is there, but if that child gets support from that age, they will go far. In the Department of Disaster, we have had community disaster response team with the CHPs, whereby as they go around the cities and the communities, they without that mental health support. When you lose a child or when you lose maybe livestock, they also go through grief. So they come to Miriti, I call Bush, I call Madam Nuru, and we say, what are you going to do during this sporting event? Because that is the only space in Kilifi County. We have 60%, they make the most of the population out of the 1.5 million that we have. We have the disgruntled, but they have to go through those phases. They are first disengaged, they feel like they're not part of the decision process. So come up with policies that also will have the mental health support or the psychosocial support in their policies. We have 4 policies so far that we've drafted in these 2 years. We have the Kilifi Youth Policy, we have the GBD policy, we have the Sexual Gender-Based Violence Act of 2023, and then now we are working on the Disaster Risk Management Policy, which still has a component of mental health support. So things in one. And lastly, Your Excellency, we have worked with MADCA, not the cultural bit, because without culture, we cannot do much. We've done lots of intergenerational dialogues, whereby we bring the wazes and the youth and do something called Dome. Dome is where we inculcate, because they're the custodians of this heritage and culture. If you don't teach the youth now or the generational alpha, because right now you're focusing on Gen Z, I think it's time to focus on Gen Alpha because it's the ticking time bomb. Right now we need to come up with strategies of how we are going to tell this child, please listen, go to church. We need to put spiritualism in our mental health, because without it, we lose focus. We need just 4 aspects. We need the parent, because parenting, positive parenting. If you do not know where I don't know where we should go from here. Lastly, I will want workplaces. The relationship with the toxic, but people do not know who to talk to. I feel like we need to start exercising community kindness within kids. Someone is not accessible, go to someone else who is going to listen to your story, or write it down. Don't think of negative vibes. I know you can get overwhelmed, but try and identify someone who will work with you. Like for us in the Department of Gender, we have all the staff, all the support staff, on how to listen to those stories, or on how to cancel that we've done. And I want to use this space, and I also want to tell people that my support is always there. Call me, I will be there. I may not be there fully forward, and we should not also lose focus on spiritualism, because that is what is going to put us together and focus and push forward. Lastly, retirement. I realize most of the Kilifi County staff, as they retire, they are not taken through the steps, because and geriatric psychiatry, if you do not talk to this gentleman or this gentle lady as she is exiting, the one that we lose fast, if you do not give them mental health care or do mental hygiene nicely. In 2 years, most of the time, they die by suicide. They won't even show it. You just say, Kazi Lienda. So I will wish, as Kilifi County, we focus on the exit and also on the entries. As we're hiring these new youth, can we take them through the counseling of what is expected of them? Because some of them have titles, degrees, but maybe the job offers that are there they're not matching with the pay. So can we first start by counseling them before they get the job? And as they leave, we cancel them out as the exit stream. Thank you so much.
Thank you very much, Waziri, for your professional input in this process. We are all linked together. Madam Deputy Governor, before you came, there was a testimony given by a lady here seated in front. And, you know, I wish Daktari had that, because when you talked about your experience, she talked about her experience. It was like, wow, these things really happen. So the more we get people to speak out, the more we fight the stigma. Because like we said, these issues can be handled and people can get support. And our friend here, she said she is in the process of getting out of that problem. You can see here, he got out of that problem and now he's an MCA. He's the chair of the health committee. So it is possible. Madam Deputy Governor, first of all, I would like to person here who, you know, Nuru to stand. You know, it's one thing to take up a passionate about this mental health issue. Even if you forget, she will always that mental health is important. So we have a champion, and she's the one who is heading mental health. Really been pushing us, all of us, to make sure that we give mental health requires. I also would like to take this opportunity to officially hand over the letters of appointment for our mental health council. We said it's going to be the group, the team that is going to lead in terms of planning and execution. So the first person, the chair of Dr. Charles Ngome, are you here? Kira? Okay. Dr. Mary Bita? Leila Abdel, and Stella Wanje. So, Your Excellency, at this juncture, I would like to welcome you. And then from here, then we'll go ahead and formally open the...
This primary, curative. Okay. Thank you so much, Madam Tariwetu, and you. Hapa naona daktari just want to mention that if you want to us within our community, but zaidi ya yote ni mshukuru Nuru Kibirigi for being that champion on health. Twasema asante sana. Na nyote ambao mko hapa, special mention to the Department of Health ambao mko hapa to ensure that this day is a success. Mental health. We should be asking ourselves, why mental health? Initially tukifikiria mental health, mara nyingi tulikuwa tunafikiri ni wazimu, si ndio? Na all the stakeholders, wajua, in any big thing, in any successes, mtu huwezi peke yako. All the nimeandika majina yenu, mumetajwa wengi sana. All stakeholders, namona mamangu hapa wa Red Cross, tuna jirani pale Kemri, kuna watu wastawisha Pwani, watu wa USA tumekuwa na wao just earlier today tukiwa tunazungumzia mambo ya child protection policy. Wote nasema ni asante, because we are looking at this health, mental health, na nimeona inagusia kila mtu. Hakuna mtu anayesazwa hapa tu, mambo kumbe ataanza tumboni. Imagine your bibi na bwana in a relationship, mtoto yuko kwa tumbo, lakini the type of environment the mother is in will affect the baby. So no one, hakuna mtu ambaye hawi affected. And it's so sad that our students are the biggest people ama tuseme the percentage ambayo wako affected the more. It's so sad. And as parents, you can imagine, some of us ambao tuna watoto wetu kule boarding schools, day schools, all these things zinatuendea, na lazima tusimame kama due diligence, ama tukishaza haya dunia ndio itakulea. No, sometimes tumewachia sana. Sisi wengine tulikuwa na viboko, hii difusimu, yani tulicheza wakati wetu. We were made to be children. I don't think at that time the cases were rampant as it is. But now there's so much, hata hii technology. Good things also cause mental health, isn't it? Umapata hapa win lottery, umpata bilioni, washikwa na butwa. I mean, wapata, yani anything affects us positively and negatively. So I think it is high time that, and I'm so proud that Kilifi County, Waziri being the second county out of the 47 to have such a facility. Hebu jamani tujipigeni makofi jamani. Chanda chema na kivikwe pete jamani. Serikali ambayo ina uwazi, yani ease of doing business, ease ya kwamba tuweza kuzungumza mambo na yakawa. Because if we also don't work with partners well, ambao wanatusaidia, itakuwa ni shida. Na sisi we want true meaning of ugatuzi uweze kufanyika. Na policies kama hizi zikiwa, zitatusaidia kila mmoja wetu. Baba, mama, vijana, watoto wote watangaziwa. Kuna speech hapa, nitaisoma kwa Kimombo, lakini kama nimezingatia yale ambayo yamo hapa, nikitambua itifaki zote ambazo ziko hapa. Kuna basic needs, basic rights, nafikiri ndio sikuwataja, na Mari projects ambao mko hapa. Asante and Amref. Theme yetu ni prioritizing workplace mental health. Workplace. Hata wale ambao tunawaita sasa wako nyanjani kule, aitwaje bottom hustler, hata si ni hustler pia ana workplace yake. So we have to look at it in that dimension. So mabibi na mabwana na marafiki na wenzetu wote wa hapa Kilifi, it's an honor and a privilege to stand before you today on this important occasion to mark the oncoming World Mental Health Day. Nafikiri ni tarehe 10, lakini tarehe 10 ina mambo mengi. Tarehe 10 imebeba kubeba. As we gather here today, we recognize that mental health is not merely an aspect of our overall well-being. It is the very foundation upon which our lives are built. Today we have the opportunity to reflect, educate, inspire one another in our shared commitment to mental health. Na kila mzungumzaji hapa ameweza kueleza kinagaubaga from the point wameweza kushikana na mental health. Tunasema it also affects all of us, and it's true, transcending age, gender, culture, and socio-economic status. Haibagui, kila mtu hasa, hakuna mtu anayesazwa. Yet, despite its universality, stigma, myths, and cultural influences often clouds our conversation. The theme for this year, prioritizing workplace mental health, I urge each one of us to join me in breaking the barriers in our workplaces, in our homes, in our marketplaces, in our community at large. Popote tunapofanya kazi, popote tunapotafuta. Let us speak openly about our struggles and our triumphs. Let us change the health-seeking behavior by sensitizing on the matter. We have to speak about it. Lazima tuambie watu kule mashinani about it. Early detection and symptoms and strengthened referral pathways. Early detection of the symptoms and strengthened referral pathways ndio zitatusaidia. This will foster an environment where everyone feels safe and supported. We know that mental health challenges can take many forms. Tumeelezewa hapa na Daktari Mary. She's doing her doctorate, isn't it? Yes. Tumeelezewa kwamba kuna anxiety, kuna depression, amesema suicide, and substance and drug abuse. These issues are often invisible. There are those that are visible, but mostly, especially depression, anxiety, are invisible, making it all the more crucial that we extend compassion and understand to those who may be silently suffering. And they have these signs. Wengine, they are withdrawn. They put themselves in a cocoon. Sometimes ukimwona mtu pia na upweke, intra, not inter. Personal skills, but intra. Sometimes just clinging to self, there's a problem. It is vital to recognize that seeking help is not a sign of weakness. No, it's not. It is an act of strength. Every time we choose to share our stories, I didn't hear about her story, but I heard about his. It gives us a time to reflect. We empower. As we look to the future, allow me to appreciate Difusimo for both in our workplaces and community where mental health is prioritized. With this partnership and that of the mental health stakeholders in this county, we can advocate for policies that support mental wellness, offering education on coping strategies or mechanisms, and providing access to professional help for those in need. Together, we can build a world where mental health is regarded with the same seriousness and dedication as physical health. I therefore want to encourage the continued opportunities for education and training on stress management, resilience, building strategies, support groups and networks, and feedback mechanisms from existing programs. We continue with surveys, research in organizations, and also in our communities. A lot has been done so far, but the gap is still huge, as shared earlier by all the spoke here. It is therefore the mandate and responsibility of the policymakers, the leadership, to support this cause. And as Kilifi County government, of course, we are doing it. Tumeanza hapa na tutashe watu wetu wanapata usaidizi unaotakikana. But you who is around us, you are the help, and avail the required resources to accomplish the objectives of our costed action plan, which is in the plan is 2022 to 2026, and with the County Mental Council. The subcommittees, ambao leo tumewapatia barua zao, shall focus on service delivery, resource mobilization, research, advocacy, speaking out, partnerships to ensure resources are aligned to the mission and vision of this purpose of mental health. I encourage each one of us to carry the spirit of this day with you and beyond. Let us be ambassadors for mental health awareness, champions of empathy, being patient, to have that listening ear and speaking out, and allies in the pursuit of healing, such that next year, at time like this, we can count our growth and impact towards improving well-being on each and every one of us. Remember, it is okay not to be okay. Together we can create a society where mental health is understood, respected, and prioritized. As I close, let us remember that mental health is not just an individual responsibility, it's a collective. Everyone should be counted, either to be one who needs help or one who is going to offer help, a shoulder to cry on, as we work together to foster a supportive and compassionate workplace. We will not only enhance our employees and the community well-being, but also drive innovations, collaboration, and success. Mimi nasema asante sana for the commitment for this vital cause, and together let us create a workplace where every one of us thrives, both in our careers and in our lives. Together, let us make that difference. God richly bless us. Nimefurahi, Waziri, for this initiative, and we are here to celebrate this milestone. Asante sana.
Naambia kwamba mtasubiri, kuna a few tu. So Maggie, daktari, this is the official launch of the Resource Center. Her Excellency the Deputy Governor with Soma. A ribbon. What? We come from. Thank you. Tunaona ameweza kuvishwa ile difusimo, kikoi cha difusimo. As I read for you. Okay. Ready? Wow! Makofi jamani, wapi makofi? As I read for you, difusimo Community Resource Center in partnership with Kilifi County. A government was unveiled by His Excellency Frola Mbesa Chibule, Deputy Governor Kilifi County, on 8th of World Mental Health Day. Makofi jamani, wapi makofi? That's amazing, nice. Okay, only a few watakuwa naenda kule ndani, alafu wale wengine watakuwa na baki. Tufungue tusifungue. Asante. Thank you. It's not official center, official launched by Her Excellency the Deputy Governor, Madam Flora Chibule Watuma. So all of you watakuwa naingia kule ndani, alafu the rest tutakuwa tunasubiri. We'll have Waziri, it's your time. Thank you, amazing. Asante sana, asante sana. Okay, Mr. Peter, utakuwa na tupa vote of thanks.
Asante sana. Kwa majina naitwa Peter Mongome, Sub-County MOH Kaloleni. Mstahiki Deputy Governor, nakushukuru kwa ujio wako katika hafla hii. Nakupenda, tunakuenzi. Waziri wetu wa Afya Peter Marogo pamoja na Waziri Dama mwenye ametoka kidogo. Pia chair Waziri Dama na chair wetu wa Health Committee ambao pia ni resident wa kwangu kule sehemu za Kaloleni Mwanaminga. Tunawashukuru pia kwa ujio wenu. Hafla hii na kielelezo chake ambacho tumeelezwa kwamba mental health is real, na tunajaribu tunapeana nafasi kuu sana kwa the bigger way. Mary, we really congratulate you for arranging this, and this center will go alongside in is also kept at high note. We will continue with raising awareness through our CHPs, so we really thank you, His Excellency the her Deputy Governor, for this endeavor. We will make sure that all what you aspire to make and realize as your objective is also realized. Partners wote jameni, kuanzia Difusimo kama wenyeji wetu, Stawisha Pwani, basic needs, basic rights, pia uzazi salama, sisi wote, mention them. You are very that is your instrumental in making sure that our mental health is real in our workplaces and in our community. I'm a champion when it comes to making sure that mental health is the main facility, which is Mariakani. So we cater for their needs. We have more than 500 cases in Kaloleni. So if we have more than 500 cases in Mariakani, and I've really taken through some counseling session with our Vespas in Mariakani when it comes to staff suffering mental health. So we really thank all the partners who have come here to celebrate this resource center. Very key for us in terms of making sure that our mental health needs are met. So asanteni sana kwa sisi wote tuliokuja. Let's go back in our health in our settings so that we also continue with the same endeavor so that we can make sure that mental health is realized in our community. Asanteni sana kwa Mwenyezi Mungu. Shukran na shukran sana. Asante.
Thank you, asante sana, Mr. Peter Mongome. Okay, naambia kwamba watu na chakula kimeweza kutayarishwa, and we have the commitment soup. That's the comments here.
That's my brother. Wewe, yani ile mdogo.
Sasa tuweze kutulia, chakula kinaletwa.